Hi everyone, today we are going to see about the importance of including WATERFLOSSER in your daily oral care. This device is not a very new device. It has been invented in the year 1962, but it's trending now due to the scientific evidence of including a WATERFLOSSER in a daily care will improve your oral hygiene much better. Let's see how. This is available in the market with a trade name WATERPIK. This WATERFLOSSER has been approved by American Dental Association ADA in the year 2017. It proved to remove the plaque from the gum line as well as between the teeth so that it prevents the gingivitis, or if you have a gingivitis, it is going to reduce the gingivitis. The WATERFLOSSER had a beneficial effect on gingivitis, bleeding and pocket. The very next question which arises in your mind is, what is the bacteremia level caused by WATERFLOSSER? So the bacteremia occurs in even on chewing a food or when you do a normal toothbrushing or flossing, the bacteremia is there. The same amount of bacteremia is being caused by WATERFLOSSER also. So nothing much, do not worry. There are a lot of comparative studies wherein they compared the WATERFLOSSER with a string floss, they compared it with the powered devices, they compared it with interdental brushes. But the WATERFLOSSER has shown to be significantly better in improving the oral health when compared to the string floss, powered devices and interdental brush. So there is a study wherein a group of people were using a manual brush along with water flossing and another group of people using a manual brush along with a string flossing. So when you compare these two groups, the group one which used a WATERFLOSSER along with manual brushing seemed to have a 93% reduction in bleeding from the gum, as well as there is 52% reduction in the gingivitis level. So if you're a person using a manual brush or an electric powered toothbrush, kindly use a WATERFLOSSER along with it rather than a string flosser, because when you combine the manual brushing or a power brushing with the WATERFLOSSER, it seems to reduce the bleeding, gingivitis and also the efficient plaque removal. If you prefer a manual brushing for oral care, well and good, but in addition to it, if you add a WATERFLOSSER along with manual brushing, it has a lot of advantage, like 3.1 times efficient in reducing the bleeding from the gums, as well as 2.7 times reduction in the gingivitis and 2.4 times reduction in the plaque level. So rather than using a manual toothbrush alone, if you use a manual toothbrush along with water flossing, you will achieve all these benefits. So the researchers have found out on comparing the interdental brush with the WATERFLOSSER, the WATERFLOSSER has much more benefit because it's going to reduce the bleeding upon probing, nearly 56% more effective than interdental brush and 20% more effective in plaque removal when compared to interdental brush. So advise your patients to use WATERFLOSSER when compared to interdental brushes. The patients who are undergoing orthodontic therapy, wearing braces and who underwent implant therapy are facing a great difficulty in maintaining their oral hygiene. But this WATERFLOSSER is an ideal device to maintain the oral hygiene in a better manner. So when you compare a normal string flossing with a WATERPIK WATERFLOSSER, there is nearly 3.76 times reduction in the plaque when compared to a floss threader. Any self-oral hygiene devices you use, there is certain depth of delivery. For example, if you use a toothbrush, it only reaches about 1 to 2 mm into the sulcus. Or if you use a dental floss, it's going to reach about 3 mm into the gingival sulcus. But if you do a water flossing, it's going to disrupt the bacteria nearly 6 mm. So they did a study on extracting 8 teeth from the patient who been suffered from advanced periodontal disease. So the 8 teeth, they did a scanning electron microscope. They found out there is several millimeter of thick biofilm. So they did a water flossing on these 8 teeth and they did a post-treatment scanning electron microscopic images. So they found out that the water flossing is able to remove nearly 99.9% of plaque biofilm from the teeth surface. So this is achieved by the sheer hydraulic forces which is generated in the water flosser, and also it is having 1200 to 1400 pulsation per minute at the medium pressure 70 psi. So it's efficiently removing the plaque biofilm from the tooth surface. There are other studies showing that the water flosser has removed nearly 82% of approximal plaque, and also in some cases it nearly removed 92% of approximal plaque. So we have already saw what is the benefit of combining a manual toothbrush with water flosser, but there are studies saying that when you combine a sonic toothbrush with a water flosser, it's much more effective than using a sonic toothbrush alone in terms of reducing the bleeding from gums, gingivitis, and also reduction in plaque levels. So if you're a person using a sonic toothbrush, kindly add upon a water flosser so that you have much more benefit. There is a new oral hygiene device which combines the sonic toothbrush along with a water flosser in a single device. You need not purchase a sonic toothbrush separately, or you need not separately purchase a water flosser. Rather, there is a combined oral hygiene device called Flossing Toothbrush, which has been accepted by American Dental Association. So by a simple touch of a button, you're going to have the benefit of a sonic toothbrush as well as water flosser in a single device called Flossing Toothbrush. So a lot of studies shows that the flossing toothbrush is much more efficient when compared to a standard sonic toothbrush or compared to a manual brush along with a dental flossing. So if you're a smart person seeking a great oral hygiene, then switch over to the flossing toothbrush. And if you like this video, kindly like, share and comment, and do subscribe to Dental Shorts for the further notification of new upcoming videos in our channel. Have a great day.